Hello everyone and welcome back to sqadia.com. Now before jumping into this video, make sure you've watched the other videos on our acid-base disorders series so that we're all on the same page. Now just by way of quick review, let's first recall the 4 acid-base disorders: metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. And in this video, we will be discussing respiratory acidosis and respiratory alkalosis. You can find separate videos on metabolic acidosis, metabolic alkalosis, and how to approach acid-base problems in general in the links provided. Now, respiratory acidosis and alkalosis are by far the simplest disorders to grasp, mainly owing to the short number of causes. So first, we'll start with respiratory alkalosis. This is when the PCO2 decreases and the pH is more than 7.45. Now going back to the acid-base equilibrium equation, this makes it simpler to understand. Carbon dioxide plus water gives hydrogen ions and bicarbonate ions. And this also goes back the other way. So whenever there is a low carbon dioxide level, the equation will go this way in order to correct the low CO2. And as a result, the hydrogen ions decrease, creating a high pH. Regarding the causes, respiratory alkalosis is usually caused by hyperventilation, which makes sense because when you are hyperventilating, you are blowing off more carbon dioxide, and this lowers the CO2 levels. The causes of hyperventilation are usually pain, which is the most common, especially post-surgery or after enduring trauma. And other causes that you should be aware of are high altitudes, where there is usually low atmospheric pressure, meaning a low level of PO2. So in this setting of hypoxia, this will cause the body to hyperventilate to make up for the change in PO2. This will then cause a low PCO2 and therefore respiratory alkalosis. After 24 to 48 hours, however, the kidneys start to excrete bicarbonate ions and the pH falls back to normal. So make sure you pay attention to the time spent in high altitudes when answering a question. Another cause of respiratory alkalosis is aspirin overdose. This essentially causes 2 acid-base disorders. Shortly after ingestion, we see respiratory alkalosis. This is because they stimulate the medulla directly, which leads to hyperventilation, since the respiratory center is in the medulla. Hours after ingestion, however, will cause an anion gap metabolic acidosis, which we have talked about in a separate video. And this happens because the salicylates block lipolysis and uncouple oxidative phosphorylation. This in turn inhibits the citric acid cycle, which you may probably recall from biochemistry. Inhibition of the citric acid cycle in turn accumulates pyruvate, lactate, and keto acids in the body, causing the anion gap metabolic acidosis. Now let's go through an example of aspirin overdose, since the best way to understand acid-base disorders is practicing different scenarios. Now for instance, we have a pH of 7.3, a PCO2 of 20, and a bicarb of 14. Now according to the pH, this is an acidosis, being less than 7.35. And since the bicarb level is low, we predict a metabolic acidosis. Now, we see that the carbon dioxide is low, and we do expect that from the compensation. But we need to check the value, if it is what we would expect it to be or not. And we do that using the Winter's formula. So the Winter's formula is PCO2 is equal to 1.5 multiplied by the bicarb level plus 8, plus minus 2. And with the numbers from our scenario, we have PCO2 is equal to 1.5 multiplied by 14 plus 8 plus minus 2. So that's 29. So the PCO2 is lower than expected. And this way we can tell that we have a concomitant respiratory alkalosis. Now that's all for respiratory alkalosis. Keep watching the next section for respiratory acidosis.